in trauma. And I also, I work for the state psychiatric hospitals in New Jersey, implementing trauma programs and trauma-informed care. So I do many things in the area of trauma, probably over the past 15 years. So I like to have an interactive training. So if you do have questions, feel free to raise your hand. Stormy, if there's any questions, could you just in the chat, just let me know, and I'm happy to answer them during the presentation. You don't have to wait till the end or anything like that. And if you want to interrupt me, feel free. I don't mind having interactions during the training. And so let's get started. So welcome to Trauma 101. This is just a little information about me if you want to know more about me. And I'm sure you guys will get the slides. So today's agenda, we're going to define psychological trauma and re-traumatization. I feel like it's very important to define trauma because most people think of it one way, and I am gonna give you a better definition for defining psychological trauma. We're going to review ways to prevent trauma spread through trauma-informed care. We're going to examine the lifelong lasting effects of traumatic experiences. We're going to explore coping strategies and self-care options. And we're going to learn 5 ways to help people heal from trauma. So these are the basics. And then in future courses, we will go over some more ways to help people heal from trauma. So I wanted to define trauma. So in the literature, there is not one specific definition for trauma. There's many different types of definitions, but as I have been reviewing the literature and really exploring with the world-renowned experts, trauma really is not the event. So most people think it's an event. And when I talk to folks, they always say, oh yeah, trauma is it's war, it's rape, it's going through domestic violence. But it's not really where trauma lies. Trauma is an injury, right? So when you think of physical trauma, it's an injury to your body. And psychological trauma, it is actually an injury. And it's actually an injury to our autonomic nervous system. We're going to touch on this today. But I thought the American Psychological Association captured it pretty well. So trauma is an emotional response to a terrible event, like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Long-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches or nausea. These reactions are actually coming from our autonomic nervous system. So they did a pretty good job of defining it. My definition is it's an injury to our autonomic nervous system that manifests and expresses itself through physiological and psychological symptoms. And we will dive further into this today. So one thing I hope you take away, it's not the event, but there's many types of events that can cause these traumatic event reactions and the injuries to our nervous system. So what does trauma have to do with me? And I like to start this off because trauma is a universal experience. We all go through experiences that overwhelm our nervous system and have a lasting impact on our nervous system. And some are, validated from others, and other types of experiences people overlook as possible traumatic experiences. So during our life, we will go through some of these traumatic experiences that can produce trauma reactions. So we all went through one, the COVID-19 pandemic, death of a loved one, a car accident. These are common ones, right? Natural disasters like hurricanes or floods, terrorism, domestic violence. Community violence is one that's sometimes overlooked by professionals. Loss of a job or income, divorce, illnesses, poverty, homelessness, lack of food or shelter, and sometimes even traumatic work events can cause these traumatic reactions. So I wanted to dive into more traumatic experiences that most people overlook. So other more common experiences or events that can be traumatizing include being discriminated against. So being discriminated for race, ethnicity, gender identity expression, beliefs, religion, mental health, socioeconomic status, weight, even age. This can cause traumatic reactions. This can impact our autonomic nervous system. Being bullied. Oftentimes, I hear people, especially with school-age kids, they experience a lot of bullying, and I've heard, like, well, this is just part of life, this is part of their growing up. No, this is actually, we shouldn't be normalizing this. This can cause extreme reactions in that autonomic nervous system. Being ridiculed, belittled, or called hurtful names, being disrespected or being disregarded, being shamed or humiliated. A lack of love or attention could be a traumatic experience that has these lasting effects on the rest of your life. Embarrassing situations, not being heard or understood, emotional abuse, growing up with parents who are not emotionally there for them, witnessing others suffer a traumatic event. So watching someone else go through a traumatic event could actually impact you as well. And that can be often overlooked as well. So are there any traumatic experiences that maybe I missed that you would like to add? Anyone? No? Feel free to, chime in. There's no right or wrongs. What I'm hoping you get out of this is that if it's an emotionally overwhelming experience, it can cause trauma. So that's what I'm hoping that people get out of this. I see a question. Let's see. Moving suddenly. Yeah, major changes, definitely. Major changes, moving, that can definitely cause traumatic reactions. So I did want to go over some of like different categories for trauma. So there's different types of traumatic experiences we can go through. There's individual trauma where it happens to a person possibly like once, like an assault or a car accident. Then there's complex trauma. This is chronic in nature. This we often see in child abuse, domestic violence, family violence, human trafficking. You can see it also in community violence if you're living in that community, right? It's chronic, and it's usually your exposure to like multiple traumatic experiences. Then there's group trauma. So with group trauma, it's a traumatic experience shared by a specific group. So like military experiencing war, firefighters fighting a fire. And then there's specifically community trauma, and that affects the entire community. So it could be gang violence, school shootings. Then there's mass trauma. That's trauma experiences that affect many individuals directly or indirectly. So it could be like the COVID-19 pandemic, 9/11, the Pacific tsunami, Hurricane Katrina. So these would be examples of mass trauma. Then there's racial trauma. That's traumatic response to race or ethnicity related experiences of racism. Some examples of that would be like racial slurs and threats, police harassment, workplace discrimination, mass incarceration, deportation, and immigration difficulties. And then lastly, historical trauma. And this is multi-generational trauma experienced by a specific cultural, racial, or ethnic group. So slavery, the Holocaust, forced migration, colonization of Native Americans. These are some examples of historical trauma. And then there's other examples of negative experiences that can have a profound impact on our lives that some are overlooked. So physical, so like bodily harm, chronic illness, a lack of food, unstable housing. So the lack of food and unstable housing, I see this a lot at our state psychiatric hospitals. Our patients struggle with this a lot and have validated that these experiences have had a severe impact on their functioning and their autonomic nervous system. So there's social experiences. So losing friendships could be an extremely traumatic experience. Feeling excluded from groups or activities could be a traumatic experience. Occupational, losing a job or getting demoted. Financial, being in debt, not being able to pay bills. Emotional, losing a loved one or a pet, being neglected, not having received consistent love or support. And then intellectual experiences. So being called or referred to as stupid, crazy, these are all traumatic experiences that can have a lasting impact on a person. It can change our nervous system and how we interact with the world and our sense of safety. So what I'm hoping you remember is that trauma is an injury. So it's not the experience, but the experience could possibly cause this injury. Let's see. The chat is disabled. So I'm seeing from Mary, my grandson was physically abused by his mom, and my grandsons were taken away from their parents from DCFS. Yes. So kids that grow up in the foster care system definitely have gone through traumatic experiences, all of them. I actually worked in the Department of Children and Families when I first started my career. And that was one of the things that I saw being ignored were the children in the Department of Children and Families. They were overlooked, their traumatic experiences. And it's what really got me into this work. Can things considered positive events cause trauma also? Usually no. So if it's a positive event, it shouldn't cause an injury, a positive event. Normally that's not typically what we see. So to get an injury, it's usually something negative that happens. So could something negative happen as a result of going through something positive? I can see that possibly happening. Maybe, you know, a positive event is, you know, you come into a lot of money, and then because of the money, you know, socially things happen to you that can cause trauma. But usually it results from something negative. So it has to come from something negative coming into your life, or it wouldn't cause the injury. So, but good question. So I wanted to talk a little bit, just a little statistics that were pretty profound to me. So the prevalence of trauma in our society. So an estimated 70% of adults in the United States have experienced a traumatic event. This was in 2018. And I'm going to say, I would say 100% of us have gone through a traumatic experience over the past few years, right? During the COVID-19 pandemic, most of us have been it impacted us in some way. A 90% lifetime exposure has been reported among psychiatric patients, and many were exposed to multiple traumatic events. So 90% from this Rosenberg article. Of people in the United States who experience a traumatic event, 20% will develop post-traumatic stress disorder. So that is an actual disorder in response to going through a traumatic event. Not everybody that goes through a traumatic event is going to have an injury, right? The psychological injury. But what I also want to say is just because you don't meet criteria for post-traumatic stress disorder, that's PTSD, doesn't mean the trauma, that injury, is not affecting your life. So oftentimes I speak with individuals and, they've gone through screenings for PTSD and they say that they don't meet criteria. But they're struggling extremely in their life with like social relationships, just not trusting people. So it is still impacting their life. It's just not enough that it becomes a disorder. But I want you to know that you're validated, that going through these experiences can cause these lasting changes on how you see the world and also how your nervous system interacts with the world. And we'll get more into the nervous system so you understand like what I mean by our autonomic nervous system. 35% of urban youth exposed to community violence develop post-traumatic stress disorder. This is something that's often overlooked and something that we have to bring more attention to. I also feel like it's really important to understand what re-traumatization is, right? So when you go through a traumatic experience, oftentimes it leaves this lasting impression on us, and there's things around us that can re-traumatize us. We can re-traumatize other people, especially in the mental health field. I see a lot of re-traumatization happening. So let's define it and, let's go through it just a little bit. So re-traumatization, according to SAMHSA, is reliving stress reactions experienced as a result of a traumatic event when faced with a new or similar incident. However, as the result of the passing of time, many people do not realize the stress they are experiencing is related to an earlier trauma in their lives. So that is important, that most people, they don't connect their current reactions and behaviors to past traumatic events, and they don't see themselves getting triggered. And we'll go into triggers as well. So it occurs when a current experience is reminding you of an earlier traumatic experience. And sometimes you don't recognize it, but your body recognizes it. So it's that autonomic nervous system sometimes just steps in. So some examples of triggering events that may contribute to re-traumatization. So anniversary dates or news stories of similar traumatic incidents, similar disasters such as a tornado, hurricane, earthquake, flood, wildfire, or the threat of these disasters. I mean, just last week, I live in New Jersey, which is really close to New York City, and the fires that were coming from Canada impacted us severely. And I will say that I heard a couple of people that went through 9/11 were impacted because New York City looked like a bomb hit it again. I mean, you could not see, like the air was so thick. And for some folks that went through 9/11, going through the fire, smoke was very re-traumatizing to them. So that's an example of re-traumatization. So events such as oil spills, mass shootings, or terrorist attacks could be re-traumatizing to a person. Distressing events reported by the media, such as car accidents, physical, sexual, and emotional abuse. So yeah, just watching a movie or hearing something on the news that's similar to your event could be re-traumatizing to a person. Witnessing a traumatic event or hearing about one that happens to someone else can re-traumatize a person as well. So what's some risk factors for re-traumatization? Experiencing a high frequency of life traumatic events such as abuse or neglect are a risk factor. So if you've gone through chronic traumatic events, that's a high risk factor for being re-traumatized. as opposed to just going through like one event, like say it's a car accident. You're less likely to get re-traumatized compared to someone that has like a high frequency of life traumatic events. Being emotionally disconnected from or not feeling love and support from others, such as family members, peers, colleagues, friends, or other loved ones. The way we heal from trauma and prevent trauma is actually through social relationships. So if you are not emotionally connected to others, you have a higher risk of being re-traumatized. And living or working in unsafe situations, such as neighborhoods that feel unsafe, if you're in combat zones or other dangerous environments. And this has to do with our autonomic nervous system. I keep saying that to you, and we are going to get into it, so don't worry. So this is a whole list of symptoms and signs of re-traumatization. I'm not going to read every single one, but I wanted to just touch on some of them. So a social withdrawal and isolation, feeling distant from other people, trouble concentrating, feeling unable to control your emotions, such as not being able to calm yourself down, a decreased sense of security and an inability to feel love, feeling on edge, very anxious and tense or easily startled. These are some signs and symptoms that you might be feeling re-traumatized by a previous event. So these are things to just be aware of. Trouble falling and staying asleep. Some of these things seem common, right? Like, we all have times that we have trouble falling or staying asleep, or we're fatigued and have a lack of energy. I just want you to be aware that maybe your nervous system is talking to you and saying, is there something from my past that might be coming up over and over and I'm not aware of it? And here's some tips to manage re-traumatization. One thing is to appreciate the impact of the original trauma. Oftentimes, we don't have someone that we can process our traumatic experience with. And without being able to process it, it doesn't get validated. Oftentimes, we want to run from our traumatic experiences and not think about it, push it away. So appreciating the impact of the original trauma. Understanding how and why the event happened, being able to connect with people who understand and help you through trigger events. Ensure that you have a support system. You're seeing this support system. It's so important to have social support. And oftentimes people who are traumatized with good reason do not trust other people and they isolate. And without having safe people in our lives that we could connect with, it's harder and more difficult to heal from trauma. It's really important to develop effective coping skills. I'm going to teach you a couple today. So these coping skills are stress management, self-care, social support, of course, especially peer support. Having a self-care plan that includes strategies for building resilience, spiritual beliefs, and having, the support of some kind of spiritual practice is really healing. And seek care from a trained, trauma-informed provider who can recognize your re-traumatization symptoms and offer evidence-based treatment and guidance. And I just want to say that these things are all coming from SAMHSA. So I just wanted to bring this up because it's often overlooked. And these are mental health diagnoses that are often related to trauma histories and traumatic childhoods. And oftentimes we don't associate these disorders with trauma histories. And they often get pushed to the side. Like trauma is often overlooked, and it's usually the underlying condition that is actually feeding the symptoms. So ADD, ADHD, borderline personality disorder, anxiety and depressive disorders, obsessive compulsive disorders, dissociative disorders, and the addictive disorders. These conditions are often related to trauma histories or traumatic childhoods, which is still a trauma history. Especially the addictive disorders, especially the borderline personality disorders. Usually with borderline personality disorders, it's a misdiagnosis. So the world-renowned experts in the field have found it highly correlating, like trauma symptoms and borderline personality disorder symptoms, they overlap. And it's usually misdiagnosed by professionals. Professionals, they usually go to these disorders and don't think about traumatic history as maybe feeding these symptoms. So, I mean, even with the addictive disorders, folks have learned to cope with their traumatic experiences by using substances. This is how they're coping. And so we just usually look at the addictive disorder rather than looking at like what's feeding the disorder. So once you start to really address the trauma symptoms, these symptoms, the ADHD symptoms, the borderline personality disorder symptoms, the addictive symptoms, they start to diminish if properly treated. So if the source of the symptoms are properly treated for most folks. I'm not saying all folks that have ADD or ADHD have a, trauma history or traumatic childhood. But what I'm saying is that for many, their traumatic histories have been overlooked. So why is trauma often overlooked? And I really like this quote by Peter Levine. He's one of the world-renowned trauma experts. He does somatic experiencing, which is a form of trauma therapy. And he says trauma is perhaps the most avoided, ignored, belittled, denied, misunderstood, and untreated cause of human suffering, which is profound. And I agree with him. So why is trauma often over-ignored? Often trauma is minimized and doesn't get the consideration it deserves. In many cases, the traumatized person does not realize that they were traumatized or it was too painful to recall. And in these folks, we usually hear that, the people that's surrounding them never validated that they went through a traumatic experience, or they said, this is life, just get over it. Like it's time to man up and, get on with your life. So they don't really know that they were traumatized. They think something's wrong with them. Like they should be better at, living life. And getting over things. It might be too shameful or difficult to talk about the unpleasant events of their past that they have endured. So with trauma comes a lot of shame. And of course, it's going to be difficult. It takes time to build safety in relationships. And so for providers, it's important to build safety and then be able to address the shame that's behind the trauma so that folks can start the healing process. Many people don't realize that their current reactions, feelings, thoughts, and or behaviors might be related to past traumas. So many people don't connect their current thoughts or feelings or reactions or behaviors to past traumatic events. So I'm hoping today that you will start to realize that there are connections to current behaviors and what people have gone through in their past. And then frequently professionals fail to make the connection between a client's current symptoms or behaviors to their trauma histories. So like the non-adherence to treatment, violence, having chronic suicidal thoughts. These can all be possibly related to trauma histories. Which leads us into trauma-informed care, right? So why are professionals overlooking trauma? And it's usually because we're not working in a trauma-informed way. We're not looking at it through a trauma-informed lens. A lot of the times we look through the medical model. We look at, the signs and symptoms, look at the DSM-5 and say, okay, they meet this criteria, they have this disorder. But when you look at it through the symptoms through a trauma-informed lens, we can see that trauma is the core of these symptoms. So trauma-informed care, it's an approach adopted by an organization that recognizes that both staff and clients have gone through traumatic events and take this into consideration in all interactions. And I love this approach because it's not just about the clients, but it's also, it's actually recognizing we all go through it, including the staff. It acknowledges the need to understand a client's life experiences in order to deliver the best level of care. I'm going to give you a handout. It's from SAMHSA and it's tip 57. It's trauma-informed care in behavioral health services. So you will have that handout. So why is trauma-informed care important? This approach strives to prevent trauma and or re-traumatization from occurring during interactions with service providers. It assumes everyone has gone through a traumatic experience and takes precautions to minimize future risks. I have seen so many clients and patients at the hospital get re-traumatized from professionals. Even when we have their best interests at heart, we're trying to maybe protect them from harming themselves, and they get, pinned down by a worker. Say they had a sexual assault history, that could be re-traumatizing to a person. So we have to really ensure that we understand what our clients have gone through and their potential reactions now. Like current reactions and current behaviors, and try to connect it to their past in order to help them heal fully. So there's 6 guiding principles to a trauma-informed approach. I'm not going to go into this deeply. I just wanted to really touch on like what SAMHSA's trauma-informed approach is, and there's 6 guiding principles. So first, is safety. So really ensuring the safety of the client. Second is trustworthiness and transparency. They include peer support as part of the trauma-informed approach. Collaboration and mutuality. So instead of just telling your clients what to do, and I'm the authority and I'm going to tell you what to do, you really use this collaborative approach. The approach also has empowerment, voice, and choice. And then lastly, it takes into context cultural, historical, and gender issues. It acknowledges them. It's not ignored. So these are the 6 guiding principles to a trauma-informed approach. So if you're doing these 6 principles, you are using a trauma-informed approach in your organization. Where, most organizations do have difficulties, and it's something that has to be maintained and developed. So I will be giving you some handouts regarding trauma-informed approaches and checklists, just so that you could kind of like, look at your organization and say, are we trauma informed, and where can we improve our services in these areas? So there is a checklist that I have. Here's some examples that I came up with which are examples of trauma-informed care. So what's not trauma-informed, and then what is trauma-informed. So not being trauma-informed is like, what is wrong with this person? So when you ask that question, like, what is wrong with this person? Instead, when you look at it through a trauma-informed lens, it's what has happened to this person to make them react this way or behave this way. A non-trauma-informed approach thought is clients are attention-seeking. They're manipulative. They're ill-willed. I see this happen a lot in by some professionals. That is not trauma-informed. Trauma-informed way of thinking would be people in our care may act out a feeling of hurt, fear, or being unheard. So it's seeing it through their eyes instead of saying, oh, they're attention seeking, or they're being manipulative. It's really looking at it through their eyes. Clients can change and stop destructive behavior if they only put their mind and will to it. That is not trauma-informed. So it's saying like, it's up to the client to change. And a trauma-informed approach is people in our care need support, they need trust and safety to make behavioral changes and heal. We're working in partnership. I'm part of it with them and saying like, you're on your own. If you want to change, you change. So trauma-informed really creates that partnership. Not trauma-informed, staff need to control clients and tell them what to do. That's the medical model. We're the authority figures, we know what's best. And a trauma-informed approach is people in our care should be treated with mutual respect and partnership. Their concerns and wishes should be listened to, and adjustments should be made collaboratively. So those are just some examples. Here are some key ingredients for creating a trauma-informed approach to care, okay? This is at the organizational and clinical level. And this is coming from the Center for Healthcare Strategies. So organizational level, so leading and communicating about the transformation process. So leadership would say like, we are moving towards a trauma-informed approach, and they would communicate that with staff. At the organizational level, it's engaging patients in organizational planning, training clinical as well as non-clinical staff members. They're starting to create a safe environment. They're preventing secondary traumatic stress in staff. So they are actually looking at their staff and saying, we care about our staff and we don't want to traumatize them. And they are hiring a trauma-informed workforce. At the clinical level, it's involving patients in the treatment process. So that's that level of collaboration and choice. You're screening for trauma. Most organizations do not screen for trauma. So that's something that I've been working on with all the organizations that I have, worked with. Even at the state psychiatric hospitals, we are just starting to screen for trauma. Training staff in trauma-specific treatment approaches, and engaging referral sources and partnering organizations. So working with organizations that do trauma-informed care, trauma-informed treatment. This is how you would create a safe physical environment. Keeping parking lots, common areas, bathrooms, and exits well lit, ensuring that people are not allowed to smoke, loiter, or congregate outside entrances and exits, monitor who's coming in and out of buildings, positioning security personnel inside and outside buildings, keeping noise levels low in waiting rooms, using welcoming language on all signage, making sure patients have clear access to the door in exam rooms and can easily exit if desired. So these are like small things that we can do, or that we often overlook in creating a safe environment. And creating a socio-emotional environment, welcoming clients and ensuring that they feel respected and supported. Ensuring staff maintain healthy interpersonal boundaries and can manage conflict appropriately, keeping consistent schedules and procedures, offering sufficient notice and preparation when changes are necessary, maintaining communication that is consistent, open, respectful, and compassionate, and being aware of how an individual's culture affects how they perceive trauma, safety, and privacy. So I did give you a handout. It's called a de-escalation preferences form. And I wanted to share that with you right now, just to review it quickly. Most folks have not used this form, and I think it's a pretty important form if you are engaging in service providing. So let's see if I can share that form with you. So I am giving you guys this handout, and this is the de-escalation preferences form. So if you're working with individuals, this is an important form. I feel that would be beneficial to your relationship and also to preventing re-traumatization. So the questions that it asks is question 1, it's helpful for us to be aware of the things that can help you feel better when you're having a hard time. Have any of the following ever worked for you? So it's giving them ideas. We may not be able to offer all these alternatives, but I'd like us to work together to figure out how we best can help you. I would say this is an important form in intake. So when you're doing an intake, this would be a form that would be really helpful to have. So then they would go through this and you would collaboratively work with them to, find out what things help them when they're having this hard time. Is there a person who's been helpful to you when you've been upset? If you're not able to give us this information, we do have your permission to call and speak to, and then giving this person so that you can contact someone that maybe has been helpful to them, that they feel safe with. And then getting their signature, of course, to be able to, contact this person. What are some of the things that make it more difficult for you when you're already upset? And these are the important conversations to have, not when they're in crisis, but, when they're able to rationally think and interact with you. This is pre-planning. And then this is about particular triggers that will cause you to escalate. So being touched, being isolated, a door open, people in uniform, loud noises, yelling. Sometimes even a particular time of the day can be triggering to some people. So it really goes through sense especially. And do you have any preferences regarding the gender of staff assigned to respond to you during a crisis? So do they only prefer female staff? Do they only prefer male staff? Do they not have a preference? Is there anything else that would assist you in feeling safe here? And you can see where this is a trauma-informed way of working with an individual. It's creating safety and helping you to understand their needs, especially when they're in crisis. So I think this is an important form, and you guys will have, this form. So let's jump back into the training. So I did talk about this earlier. So how do we screen for trauma? It's really important to be able to understand what this person has experienced and what they've been through in their life in order to better assess what they're potential triggers might be to prevent re-traumatization from happening, and then also just being able to connect them with services that might be helpful to them, or referring them out to further trauma treatment. So what I've found is folks that, well, organizations that say they do screen for trauma, I have found that they use an open-ended screening question for trauma, which is not helpful. And it usually happens on the first day of intake. And it asks, something along the lines of, have you experienced any traumas? And this question is usually not helpful, first of all, on the first day, because the person does not trust you. Second of all, when you ask, have you experienced any traumas? Most folks think of traumas as, I haven't been through war, so no, I haven't been through any traumas. Or they know that, they think of the bigger traumatic experiences like rape or domestic violence. Those are the three that people will acknowledge. The other ones that we went through, those traumatic experiences in the very beginning of this presentation, many of our clients have gone through, and they don't consider that a traumatic experience that could have a lasting impact on them now. So they're going to say no to this answer. And for most forms that I've gone through, and just reviewing some organizations that do screen for trauma, many of the clients have said no to this question. So it's better to use a standard form that captured a wide variety of traumatic experiences. And you can take some of these forms and actually tailor it to your client's needs and your client's traumatic experiences. And I would say complete the screening within the first 30 days of intake, but not during crisis. So usually when they're coming in, they may be in crisis. I would say not on the first day, but probably within your first, 4 meetings, I would go through a standard form. And I'm going to give you an example of a standard form. So for the state psychiatric hospitals that I work at, I was running some trauma groups there. So I created a trauma group. And during some of our conversations, some of my clients at the hospitals said, so Miss Giovanna, is not having enough to eat, is that trauma? Is that trauma? Because that has had a lasting impact on my life. And I said, yes, of course it is. And I remember the client saying, well, then why isn't it on your form? Why isn't it on your screening form? And I was like, you know what? That is a good question. Why isn't it on this standard screening form? And guess what I did? I added it to the form. I had another one that said homelessness. Why isn't that on the form? And I was like, you're right. And I'm hearing a lot of clients say that, going through homelessness was an extremely traumatic experience for them, but it wasn't captured on the form. So what I did was I adapted the form to meet my clients' traumatic experiences. So if I'm hearing these common themes of traumatic experiences, I added it to the form. And I'm going to show you the form that I adapted. So I used a standard form and then added traumatic experiences of my population to the form. And let's see. So there was a standard form. It had have you gone through combat? Have you gone through war? They did take sexual violence in, they did take child abuse in, but these specific traumatic experiences I kept hearing from the population that I was working with. And I just added it to the form, and we called it the trauma history form. So being teased or bullied was something that had a lasting impact on my clients. Being involved in gang violence, they living in a neighborhood where they feared for their life. Many of them experienced police brutality or police harassment, being homeless. So these were the themes that I was hearing, and I added it to the form. They felt endangered for their life because of race, gender, or ethnicity. And you see that I said, have you ever had a period of time where you did not have enough food to eat? So these were their common experiences. So I added it to the form. And the reason I used this specific form was because it was a yes and no question. All we really needed to do was know, like, what were their traumatic experiences? And then potentially as a team discuss, well, what could be potential triggers, and then also symptoms and behaviors that might be from these traumatic experiences. So that's really what we used this form for, was to prevent re-traumatization and then also inform treatment. And I did give you the entire form, so you will see the form. It's in the attachments. So the other important part that I've been talking about that I feel is important to go over in defining trauma is our response to threat. So we are all built to survive in this world. Our body does this naturally. And the really cool thing is, in our brain, we actually have an alarm system, and it's called the amygdala. And it's designed to protect us from danger. Once that amygdala goes off, so once our alarm system goes off, not by choice, our nervous system is what sends it off. Okay, so it is triggered in the environment, the amygdala goes off, and we automatically go into a fight, flight, freeze mode. We're going to go over that. But once the alarm is set off, hormones rush through our body. We don't make this choice. It's our brain that makes this choice. So this sends our nervous system into fight, flight, freeze, or a couple of the other ones is like fawn, faint, and collapse. This is not done by our choice, but it's something that our brain and body does automatically to protect us. You've heard of survival of the fittest, right? Our bodies are built to survive. So it's constantly scanning the environment for danger. This is just how we're built, all of us. For people that have gone through multiple traumatic events, it's more sensitive. Your nervous system, if you've gone through a lot of traumatic events, it's learned to be more sensitive to danger. So that amygdala is going to go off more quickly than someone who hasn't gone through many traumatic events. And so for the clients that we serve, especially clients that have gone through community violence, that have psychiatric disorders, they have amygdalas, a good majority of them, that are more sensitive because they've gone through so many things that their body's like, no, this world is dangerous and I need to protect myself. So they have sensitive amygdalas. And how do you know that your amygdala is going off? It's usually physiological responses that let you know you're feeling threatened. And we don't know this. Many folks don't know this. But if your heartbeat starts to increase, your breathing starts to increase, you're sweating, you feel butterflies in your stomach, you feel like your blood pressure is increasing, you feel your muscles tense. Some folks say that they have tunnel vision, like where they're just like really focused on one thing. Their hearing may become selective, like what is that? This is your nervous system talking to you, and your amygdala has already gone off. It's telling you danger, danger, and you're starting to pump hormones through you, like cortisol and adrenaline. So, what are normal reactions to abnormal events? So, we have different reactions in our bodies. We have physical reactions that our nervous system is telling us we're in danger, cognitive reactions, emotional reactions, and interpersonal reactions. So with physical reactions, if you're feeling easily startled, you have insomnia, fatigue, fast pulse, tension, stomach aches. These are your nervous system is talking to you. Cognitive reactions, trouble concentrating, intrusive thoughts, difficulty making decisions, confusion and shortened attention span. These could be signs that you're having some traumatic reactions. that you're not feeling safe. Emotional reactions: fear, grief, anger, irritability, guilt, shock, shame, feeling numb, feeling helpless, a lack of motivation. These could be some common traumatic reactions. And then interpersonal reactions. So feeling withdrawn, distrust, loss of intimacy, having a lot of conflicts, feeling on edge or short with people, feeling rejected or being abandoned. These are all interpersonal reactions that your nervous system is talking to you. You're not feeling safe. So how does our brain respond to threats? So remember that amygdala, that's our alarm system. Like, how does it go off? Well, it goes off from something in our environment, and it's usually through our 5 senses. So either we see something that is threatening, we hear something that's threatening, sometimes we smell something that's threatening, taste or touch. These things could potentially cause us to go into this survival response. And as soon as we see it, hear it, smell it, taste it, or even touch it, that amygdala goes off. The alarm system goes off. It's not something you can control. I want you to know that. Like, it's not something we control. It's our body protecting us, saying, I smelt this whiff. It reminds me of this in the past. And immediately your body goes into this response. It's not something we can control when our body goes into the response. So trauma affects our autonomic nervous system. And I want to go over this simply. It's really easy to understand. We have 2 divisions in our autonomic nervous system. Well, actually, let me tell you where it is. So our autonomic nervous system runs along our spine. So it's from the base of our neck all the way down, and it's our spine, okay? And it has 2 divisions. So there's the sympathetic nervous system. I want you to think of our sympathetic nervous system as our gas pedal. It's what revs us up and what's pretty much going to save us to survive. Okay, so it revs us up. So when you press that gas pedal, we're off. We're in that fight or flight stage. So it's responsible for fight and flight. And it's usually reacting in those emergency situations. This sympathetic nervous system, it's what reacts to the triggers, okay? Now we have another part of the nervous system. It's called the parasympathetic nervous system. That's our brake. It's what helps us to feel calm and in control. And they work together, okay? So with the parasympathetic nervous system, it calms us down by lowering our heart rate and our blood pressure. It also helps us with everyday activities like digestion and waste elimination. So if you're having digestive problems, you're having problems with like constipation, going to the bathroom, things like that, it's telling you your parasympathetic nervous system is not working so well, because you have to be in a calm state for these things to actually work. And there's ways for us to control our sympathetic and parasympathetic nervous system. I'm going to give you a few ways today. So they regulate each other, okay? And so let's go over like what can cause the sympathetic nervous system to be activated, okay? So triggers. Triggers is what activates the sympathetic nervous system. That's the gas pedal, okay? So what kind of triggers? A threatening experience, person, or environment. So remember, the triggers is what we see, hear, taste, touch, right? A person's features or demeanor can be a trigger. Certain gestures could be a trigger. So for some folks, just a smirk could trigger a person to go into that fight, flight, freeze state. So it turns that sympathetic nervous system on. Facial expressions, choice of words or sounds could be triggers. Certain smells, raised voices, certain histories, work pressures can be a trigger. Lack of support can feel like a trigger to a person. Certain behaviors, certain personalities, and a name associated with a threatening person could also be a trigger. These are some examples. There's so many types of triggers. This is why it's really important to understand a person's traumatic history. Like, what traumatic experiences have they gone through, so we can better understand and connect what could be a person's potential triggers, so we could try to mitigate these triggers and lessen the effects of these triggers. And for most folks, they don't even know that they're being triggered. So basically anything that's associated with a past threatening event. So let's go through this really quickly about like survival mode and our ingrained reactions to threat. So we do not choose these states. So when our sympathetic nervous system gets turned on, that gas pedal, we don't choose what we're gonna do, okay? Our nervous system, the sympathetic nervous system, it makes a choice very quickly. So we're either gonna fight, flee, so it's fight, flight, freeze, fawn, or hide, okay? So fight is to attack or confront aggressively. So those folks that have those anger problems and immediately go into anger, just want to let you know, like from a nervous system perspective, that person is actually in the fight mode. They're in fight. All of us, when we go into that aggression, we are turned on. Our sympathetic nervous system is turned on, part of our survival response. Flight is to run or flee. Then there's more passive bodily responses. There's a freeze response when you feel like you're unable to move. And then there's fawn or hide. These are newer ones that the trauma experts and trauma masters have found. And they found this in people that like, they just hide or comply with who is attacking them. And these are all survival responses. This is how we survive an experience. I love this infographic. I thought it really captured how the nervous system responds. So usually with the nervous system, like how does it respond to trauma? It first identifies the threat. So, and this is all done very quickly. Our nervous system is designed to keep us alive. So immediately when it sees a trigger, it's going to say to itself, can I escape? If it makes the decision it can escape, then it's going to try to run away. If it can't run away, then it thinks, can I overpower it? If yes, then it's going to fight. Okay. And if it thinks it can't overpower it, so if it thinks it can't escape, if it thinks it can't overpower it, it's going to say, well, can I make it lose interest by freezing? And will that keep me alive? And if that doesn't work, what happens is animals, so it's animals and people, we're all built this way. It will collapse. And the collapsing part is where the person dissociates. They're not feeling it anymore. So if that, let's see. So there's a great video about an impala about to get eaten by a cheetah, okay? And so the cheetah's running after this impala, it captures it, and you immediately see it collapse. So it has it by the neck, and it's in this collapsed state. It looks like it's dead. It looks literally like it's dead. And the thing is, when it's in this collapsed state, endorphins and different types of hormones flood the impala. If it gets eaten, more than likely, it's not going to feel it, okay? But if it survives, so the cheetah in this video, it's very interesting. It got scared off, right? And it releases the impala and it runs off. And the impala still looks dead. All of a sudden, you start to see it start to breathe again. And then it starts to shake. The shaking is actually the autonomic nervous system regulating itself, getting back, releasing all that pent-up energy, and you see it run off. And this is how we all work and how we all operate. I've seen a lot of folks shaking after a traumatic event, and we actually do a disservice to folks that have gone through a traumatic event and try to stop their shaking. It's actually letting the nervous system release that pent-up energy. So when we try to stop someone from shaking, just let them know this is normal. It's okay to shake. The nervous system is resetting itself. So we have these natural, ingrained ways of surviving and protecting us that sometimes as humans, we've learned to suppress or think it's bad. So trauma and its lasting effect on the autonomic nervous system. I thought this was really important. So multiple traumas or chronic traumas, including ACEs. So I think we are going to be doing an ACEs presentation for our next presentation. That's adverse childhood experiences, continually activate a person's survival response. So when you go through multiple traumatic events, remember that nervous system, your sympathetic nervous system, that gas pedal is chronically turned on. You're more likely, your amygdala is constantly looking for danger. And for some folks, they perceive danger where danger doesn't exist. So just like like certain facial speech features, a person that have gone through multiple traumatic events might perceive as threatening and immediately go into this fight response. And, even with service providers and say like, oh, it was unprovoked. Like I didn't do anything. Like the client just, attacked me for no reason. Well, usually there is a reason. Their nervous system picked something up that was threatening. So when your client is in this chronic fighting mode, just know that their nervous system is talking to them and they're feeling threatened. Somehow, something is triggering them. So their brain and autonomic nervous system is on guard and constantly scanning for threat. Their mind and body is chronically in survival mode. Their sympathetic nervous system is frequently turned on, and they have difficulty activating the parasympathetic nervous system. That's our break. That's what makes us feel calm, cool, and in control. The person has a hard time accessing that. Their body has a hard time going into that calm state, that controlled state. They have a hard time controlling it. And Dr. Bessel van der Kolk, he is one of the world-renowned experts in trauma, and he states, after trauma, the world is experienced with a different nervous system. I'm not going to read the whole other part of the quote, but we have a different nervous system when we go through traumatic experiences, especially those who go through chronic traumatic experiences. So how do we regulate our nervous system? You're going to think, these seem very simple, but this is how we regulate it. We develop a toolkit. And this toolkit is going to activate your parasympathetic nervous system. One easy one is a breathing exercise. And I'm going to tell you why breathing exercises work and why for many folks, they've been taught breathing exercises and they don't work for them. Okay, so with breathing exercises, they actually activate your sympathetic and parasympathetic nervous system. When you breathe in, your sympathetic nervous system turns on. When you breathe out, your parasympathetic nervous system turns on. So the key to the breathing exercises, for breathing exercises to work, you have to have a longer breath out than the breath in. And I've seen a lot of folks say, take a deep breath in. You just activated your sympathetic nervous system, that gas pedal. And if you focus on only the breath in, or you tell a person to take a deep breath in and hold their breath, for some folks, it's going to cause a panic attack. So the key to really regulating your parasympathetic nervous system is the breath out. So it's a long breath out. So as long as you're doing a longer breath out than your breath in, you're going to be able to start to control that parasympathetic nervous system and turn it on. So that's our break, right? Parasympathetic nervous system is our break, and we activate it with our breath out. So like an easy one is just a sigh. Taking that sigh activates our parasympathetic nervous system. So it's a great one to use for parasympathetic. Grounding exercises. So there's a 5, 4, 3, 2, 1 technique. I will go over it quickly. There's progressive muscle relaxation. Remember that trauma stays pent up in our body. So we're feeling tense, right? Like we're feeling like it in our shoulders or in our muscles. And progressive muscle relaxation actually like has you squeeze and then relax. And that actually turns on the parasympathetic nervous system. There's also movement. So any kind of movement exercises, getting your body moving can actually turn on the parasympathetic nervous system. So that let's practice a simple breathing exercise together. I know that we're coming close to the end and I wanted to make sure that we get through everything. So, just the breath out is really that simple breathing exercise. So any kind of breathing exercise that you find with a longer breath out is going to help. The best one that I've found for many folks that's easy is taking that sigh. So, or a simple breath in. So a normal breath in, and then a long exhale out, like you're breathing through a straw. It's the breath out that turns on the parasympathetic nervous system, our break. So if you can remember that, that's great. For some folks, they do find that like taking a deep breath in does help. And that's perfectly fine. But just remember that it's the breath out that's turning on the parasympathetic nervous system. Like this is how we're designed. So it's the breath out that's really relaxing you. So the breath out. So the grounding exercise at 5, 4, 3, 2, 1, remember, we get activated by what? Our 5 senses, right? Something you see, touch, taste in the environment. How do we counteract that? Actually by grounding ourselves in the current moment and saying, okay, so what are 5 things I can see? And you look around the room and you find 5 things you can see. Then you look at 4 things you can feel. So like you can feel, your shirt on you. I can feel like my cup of water. So you go through with your client saying, 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and then 1 thing you can taste. Even if it's just water, you can taste water. If a person has gum, they can taste their gum in their mouth or something they ate previously. But it's really about grounding your senses in the present moment. For folks that have gone through traumatic experiences, often they go through flashbacks. So if you're prone to a flashback, meaning you're going back in time and feeling like you're reliving your traumatic experience, this grounding exercise is really great because it's grounding you to the current moment. And this is the progressive muscle relaxation. You could actually Google progressive muscle relaxation script, and they will give you a script to go through. And usually with progressive muscle relaxation, you can either start at your forehead, like the top of your head, or your toes. And you literally are going to scrunch your muscles and then for a few seconds and then relax them. And you go through like through your body or up. It could be up or down. So you can start at your forehead and then move down to your eyes, to your mouth, to your chest, to your shoulders, and move down your body. Or you can start at your feet, scrunch your toes, and then, tighten your calves and then your thighs. So it's really about getting in touch with your body and feeling it tense up and then relax. The relaxing is the part that activates the parasympathetic nervous system. Really simple exercises. So I also wanted to go through the negative effects of trauma. And this is the negative effects of trauma on your mind and your spirit. Trauma, remember that injury, it changes our view and sense of safety. For some folks, they feel like the world is a dangerous place or people are not to be trusted. That's where the trauma lies. It changes how you view yourself, your goals, and your dreams for the future. So that's where the trauma lies, right? It's the injury, the long-lasting effects it has on our lives. It changes our relationship with others. It's how you show up in relationships. It changes your relationships with friends, with family, with colleagues, as well as how close or distant to be with them. And then also it changes our emotional awareness and expression. We have trouble expressing how we feel. We become easily overwhelmed emotionally. Anger can be the go-to emotion. We can feel emotionally withdrawn from others, feelings of detachment and numbness. So this is how trauma, that injury, impacts our mind and our spirit. And then I also wanted to touch on, like, well, how does trauma affect individuals receiving care? Well, for the people that we serve, it can create a poor therapeutic alliance with treatment providers if we are not trauma informed. It can cause people to be constantly on guard and misread social cues. So even though you have good intentions when you're providing services, your client might be on guard with you and misread your social cues. They might have difficulties with emotional regulation because their nervous system becomes dysregulated very quickly. Why is it becoming dysregulated? Because their amygdala is picking up threat in the environment. Even if the threat is not there, it's picking it up. And oftentimes we see that as symptoms of other mental illnesses. Remember those lists of mental illnesses that we were talking about? It's usually the nervous system dysregulation that's causing these symptoms. It exacerbates other mental health symptoms. So trauma exacerbates other mental health symptoms. So you might have mental health symptoms, but the trauma can actually exacerbate them. For folks that have gone through multiple traumatic experiences, they usually have higher levels of distress, which can increase the risk of mental health hospitalizations. They have an increased risk of substance use. They have an increased risk of self-harm and suicide. And they also have an increased risk of heart disease, chronic lung and liver disease, diabetes, and cancer. And this we will touch on in the ACEs, the adverse childhood experiences. But just quickly, I'll let you know that what happens is, remember those hormones that are rushing through our body? So we have hormones that rush through our body to try to protect ourselves, right? When the amygdala picks something up in the environment, hormones rush in. And when it rushes in, it's usually cortisol is one of them, adrenaline is one of them. We need that to fight or flee from our attacker, right? But if it's happening chronically in a person's life, those hormones are running through the body constantly. And that's where these diseases, we are not built to have cortisol running through our bodies 24/7. Cortisol, adrenaline, can damage our organs and make us more susceptible to these diseases. So it can cause these diseases. And we'll talk more about that in the adverse childhood experiences presentation. And so I just wanted to quickly go through 5 ways that I discovered to help clients heal from trauma. And these are simple ways. The first thing you want to do is create a safe place for the person. The second thing you want to do is educate your client on trauma and traumatic experiences. And ACEs are adverse childhood experiences. Teach them coping skills, build a support network. So those coping skills are going to help them control their autonomic nervous system. You're going to build support networks for them. Why? Because in order for us to heal from trauma, we need social support. We're social creatures. That's how we heal. We do not heal in isolation. The last thing you want to do is build self-efficacy, because trauma it impacts you in the way that you don't feel like you can take care of yourself, and you're constantly blaming yourself. And so building self-efficacy for your clients is a huge component of healing trauma. And these are the ways that you would create the safe places and educate. I just want to stay on just make sure that we're staying on like within our time frame. I know we started a little late, so we are towards the end of the presentation, but I did want to like just touch on a couple. So creating a safe place is educating yourself on trauma-informed care best practices, creating a safe relationship with your client, use reflective listening, validate without judgment, being empathetic with your client, establishing and maintaining boundaries. Oftentimes with trauma, boundaries have been crossed. And so we want to be able to establish boundaries and maintain them. We want to build trust. We don't want to shame or blame, and allow and accept all feelings like anger, sadness, fear, and terror. You want to definitely screen for adverse childhood experiences and use a trauma screening form. Connect their traumatic experiences to some of their current struggles and behaviors. You want to teach them about the health effects of ACEs, which we're going to go over in our next presentation. We're going to refer clients to trauma services and specific treatments, and help them to identify their triggers and tailor coping strategies to specific triggers. That will make them feel in control and more safe. They don't know they're being triggered oftentimes. Then teach them coping skills to regulate that autonomic nervous system. So breathing exercises, grounding techniques, using sensory tools are really helpful. Routines for exercise is really helpful. Positive self-talk is a great one. Journaling. Also, we overlook music and art. So anything like that can help self-soothe that autonomic nervous system. And then building support networks. For folks that have gone through multiple traumas, they have a really hard time trusting people. So really helping them to figure out where's the safe people that I can go to and to start to cultivate those relationships. So practice social skills with them, help them join a support group, help them join an activity that maybe can help them find support, help them connect to supportive family and friends, maybe reach out to coaches or mentors. Also ensure they are engaging in medical services for care and prevention. Because remember, they're more susceptible to those types of diseases. And then lastly, build self-efficacy. You're going to examine their strengths with them and build on them, recognize and celebrate any amount of progress. So we don't want to overlook the small things, create meaning from failures, teach them basic organization skills. Like time management, help them to create a predictable routine or schedule in their life, and then help them to goal set. All these things would build self-efficacy. These are some books I highly recommend. The Body Keeps the Score. This is by the world-renowned trauma expert. I highly recommend reading this book. There's a great book called The Boy Who Was Raised as a Dog. This is actually a complex PTSD workbook. And all of these I'm recommending to you and your clients. These are great things that are resources that can better help you understand how trauma is impacting your clients, and also resources on how to start to heal from trauma. So all of these are great. In the realm of Hungry Ghosts, this one is great for those who struggle with addiction problems. And Scattered Minds is the connection to ADHD. I suggest everyone watch this quick TED Talk. It's 15 minutes. It's a wonderful TED Talk and resource. It's great for clients, and all providers should watch this. And then these are the handouts I'll give you. The standardized trauma history form, activities to activate the parasympathetic nervous system, those 5 ways to help your clients heal from trauma. I turned that into a handout. The de-escalation preferences form, a trauma-informed organizational assessment. So remember, for trauma-informed care, there's different things that you need in your organization. And it's like a check-off list of like things that you're doing well in, and then things that maybe you would want to improve in your organization. And then the SAMHSA tip, trauma-informed care and behavioral health care. So if you have any questions, you can ask me questions now. And then also I'm more than happy to answer questions later on if you want to email me. That's my email address. And yeah, this is the end of the presentation. I know that we probably went over a couple of minutes, but we did start late. So I'm going to go into see if you guys have any questions. Oh, we have a bunch going on over here. Kim.
So really quick, just wanted to say thank you again for your presentation. This was fantastic. If people do have questions and if you've got time, you are more than welcome to just kind of hang out, ask questions. Anybody else, if you've got, another meeting scheduled, whatever, feel free to leave. We will be sending a link to the recording as well as the slides and all of the handouts. So yeah, thank you again. And yeah, if you want to hang out, we'll leave the room open until you guys are done.
Are they allowed to talk? I didn't get that. Are they?
Absolutely.
Oh,
yeah.
okay.
At this point, I believe you can unmute yourselves to be able to talk. If not, then I can change the settings if I need to.
And I will try to go through some of these questions that I've missed. I'm sorry. Let's see.
Oh, you know what? Actually, that is my mistake. So since it was set up a little bit differently, they actually don't have a microphone option.
Oh,
so yeah, so it'll have to be in either the Q&A or the chat where they'd be able to ask the questions.
Okay. So it's going to be in the chat, the questions, right?
Yeah, either one. Either it looks like there's quite a few in the Q&A right now, and then if they want to also use the chat, then they can also use that.
Okay. Let's see if I can answer some quick questions. What's the link for the TED Talk? It's going to be in the presentation. Like when you get the presentation, the link is going to be in there. So you will have a copy of it. If you can't access it, just email me and I'm happy to send you the link. Can you please send the link? Yes, you will definitely get the link and the PowerPoint presentation. So the link is embedded in the PowerPoint presentation. When in trauma, can a person dissociate and let another person talk for them? I've seen this happen with severe traumas. Okay. So what you're talking about is dissociative identity disorder. Some people know it previously as multiple personality disorder. That's extremely rare, but it does happen in people that have gone through extreme chronic traumatic events. It usually happens because of childhood sexual abuse. It happens often, or physical abuse. But that usually happens because of some kind of traumatic event that has happened in childhood where the child couldn't escape. And then what happens is they break into parts, and these parts in adults help them cope. Someone asked if the brain can be retrained to act in a different way. Yes, definitely. That's what I mean by being able to control our autonomic nervous system helps us to retrain the brain. There's other things that we can do to process trauma, and we can go further into this in other presentations. But yes, the brain can be retrained. Yes, definitely. What are your thoughts on the ACE screener? Well, you will hear more about the ACE screening in our next presentation, but I think it's an important screen to understand what clients have gone through. And it also connects to potential things that we can look out for. So the higher your ACE score, your adverse childhood experiences that you've gone through, the more likely you are to have some kind of medical issues and mental health issues. So I think it is an important screening. Do you recommend allowing clients to opt out of screening? Oh, yes. Yes. We don't force people to do anything. If they do not, or if they don't want to fill it out, we don't force anyone to fill anything out. But you can always say, this might not be a good time for you. Would it be okay maybe if I asked you in a month or something like that? There's other ways to go about screening clients for trauma, but we don't have time right now. So maybe I can bring that up in a future presentation. Regarding screening for trauma, what was mentioned earlier about the importance of understanding a client's life story? At what point do you make the priority call between trying to understand a client and making sure their privacy is respected? Can there be benefits to asking only need to know questions of clients? I think it depends on like what your position is, right? So if you're providing services to a client and what types of services you're providing, if you're providing therapeutic services to a client, that might be different than if you're just connecting them to resources in the community like case management. So it really does depend on your position. If you're doing like therapeutic work with a client, then you're going to probably go into some of the more private, experiences a person has had. So yeah, there's a balance between that. That question probably requires a little bit more of an in-depth response that I don't have time for right now. Do shooter on campus drills trigger trauma? Oh my goodness, yes, it can definitely. So just going through drills can definitely cause your autonomic nervous system to not feel safe, right? Because when you're going through a drill, it's saying this is a potential for you to be killed or seriously injured. So going through these drills can cause your nervous system to say, I'm not in a safe place. I have to constantly scan for danger. And then on top of that, if you're doing shooter drills with a person that has already gone through traumatic experiences, or maybe they live in a dangerous neighborhood, so their nervous system is already primed to look for danger. And then they're saying you're in school and you're doing shooter drills. Not even in school can I feel safe. So their nervous system is being primed to always scan for danger. So drills can definitely cause traumatic feelings. Yes, good question. What about a child with mental health issues, anger from a young age, which turns into addiction? This child is a grandchild. Could the trauma affect the grandparent? Yes, well, the child probably has gone through traumatic experiences that are causing the anger and mental health problems. And then, of course, a person that is seeing and interacting and trying to help the client heal can also have traumatic experiences of watching their loved one go through these experiences. So I think both the grandparent and the child are having a traumatic experience. It's not just one or the other, but both are going through the traumatic experiences. I think we're back to where I saw, can things considered positive events cause trauma? Is there any other questions? I see there's 64 participants still, so I will try to scroll down. I will have to stop soon just because I do have another meeting to go to, but let's see. Do you have resources or ideas to heal or start the healing process? So one of the things is some of those books, The Body Keeps the Score is a great place to start. But I haven't seen a lot out there on actual healing and moving on, besides understanding and identifying trauma, how we begin to move forward and away from it. The best resource is to go to a trauma-informed therapist. That's one of the best ways to start to heal and move on from trauma. So being able to establish safety in your life, to establish coping skills that you can use, really identifying what your triggers are, but then also seeing a trauma-informed therapist. I'm going to tell you, there's not many out there. There's not enough out there. It's just starting to become part of mental health care that therapists are trained in trauma. And usually they have to go through specific training. So there's EMDR training, cognitive processing training, specifically for trauma. So when you find a therapist, you need to ask them, are they trauma trained, and in what modalities are they trauma trained? There's different modalities to trauma training. Beyond understand. Yeah, I read that one already. Let's see if there's any more. I'm not really sure about that question. It says, I have worked with participants who are well aware of their trauma and are in a way over it. Not sure what that means. Can someone develop PTSD if they experience severe? Yes, you can definitely experience trauma and post-traumatic stress disorder from severe mental illness like schizophrenia and having hallucinations. You can actually get traumatized from the mental illness. So yes, definitely. And we shouldn't overlook that. What are some ways to help with having an out-of-body experience? And is this due to possible trauma? Yes. So that's usually dissociation. And remember that 5, 4, 3, 2, 1, that's one simple way of grounding yourself back in the moment. So if you're having an out-of-body experience, that means that you're not present in the moment. And so to ground yourself in the moment, one of the best ways is to use the 5, 4, 3, 2, 1 technique. Can we share and view this presentation with our team? I think they are sharing the presentation with you. I think you're getting an email with it. So that's up to Veronica and Stormy as to what you're doing with the presentation. So Veronica, are you still there?
I am, although I missed that question.
It says, can we share and view this presentation with our team? It's from Michael.
Oh, to be honest, that would be totally up to you, as long as you're fine with them sharing it with, people that weren't able to attend today, then yeah, that would be perfectly fine.
Yeah, definitely. I mean, the more people that know about trauma and the effects and the lasting effects, and then also having some coping skills, I think the better. So it's my passion to just share, the information I know. So yes, of course, share it.
Perfect. Yeah. So then, yes, we will be sharing the recording, the handouts, the slide deck, all of that stuff, here within the next few days once we get it all compiled.
So yeah, for me, if you need anything, Veronica, if you need to talk or anything, Michael is raising his hand. Michael cannot speak though, right?
Correct. Yeah. Unfortunately, since it was set up as a webinar, then yeah, it disables the mic.
Okay. Can someone who doesn't have dissociative identity disorder have okay. So yes, I see one more question. I do want to answer this. So it says, can someone who doesn't have dissociative identity disorder have a dissociative experience? Yes. Dissociation is a common trauma reaction. So remember that fight, flight, freeze. Dissociation is the freeze response. So you freeze or the collapse response. So yes, you do not have to have dissociative identity disorder to have dissociation. It's a common experience, and it's a way of our nervous system protecting ourselves. So our body is trying to protect itself. So yeah, you do not have to have dissociative identity disorder to dissociate. So it's common.
Okay, well, I think that's probably about all the extra time that we have. So Giovanna, thank you again so much. This was really great. I know it looks like you gave your contact information, so anybody feel free to reach out to her. Also reach out to us here at IACAA if you need anything. But thank you again, and we'll see you for session 2.
Sounds good. Thank you so much.
Absolutely.
Bye, everyone. Take care.